I think what makes me unique in my practice is actually what I did before I became a physician. I worked as a science writer for the National Institutes of Health, and I actually think that that was the perfect training for a physician. It gives me the ability to take really complex medical problems and try to translate them into language that any person could understand. I became an obstetrician gynecologist honestly because I couldn't imagine myself doing anything else. I never actually thought that I would become an OBGYN, but I went through all the different specialties as a medical student, and I couldn't imagine myself doing anything else. I enjoy taking care of women. I enjoy being part of their lives during such critical moments in their lives, and I wouldn't change it for anything. When I meet a new patient, honestly, I think the most important thing that I do to make her feel comfortable is I try to leave everything else at the door. As I walk into the room, I leave everything else behind, and I really try to focus and concentrate and listen to what that person has to say so that we can come up with a decision together about where to best proceed. I think the most important thing for a woman to get the most out of her healthcare is actually to be honest with us. I think a lot of times people, when they're confronted with certain questions, feel like they have to give us the answer that we want to hear, but we really want the answer that's the real answer. We can't help people if they're not giving us the appropriate information. So I think it's important for people to be realistic with themselves and realistic with us so that we can come up with solutions that'll work together. My husband and I have two beautiful children. Our son, his name is Owen, and our daughter is Juliana. It feels like these days we spend a lot of time taking our children to their various activities that they've become involved with. We moved to this area. My husband actually grew up in Menominee, and so it was sort of a homecoming for him, and we've really been enjoying it. So it's a great community to raise a family. I'm Blenda Yun, Women's Health.